The third member of the Dream Bigger panel this morning is Joy Correia. Joy works as a labor relations officer with the Non-Academic Staff Association, known as NASA, at the University of Alberta. She is a member of CUPE 1158 and an active leader in the Canadian Industrial Relations Association of Alberta. She will talk about essential health services that are currently not covered. So take it away, Joy.
Thank you. My topic is the dental care and vision care, and I wanted to talk about it more in a provincial context as opposed to the national context, because I think there's more opportunity there. But before I start that, I wanted to just go back to the roots of our universal medical care plan. And it's really interesting, a little bit of reading that I did, to understand that healthcare began as a response to some real issues about access to healthcare and appropriate healthcare. Back in the middle of the last century, there was a huge financial barrier for people to access healthcare. The healthcare system was basically pay me first and then I treat you. So people died waiting for their friends and family to gather enough funds to pay for the treatment that they required. So as we all know, Saskatchewan was kind of the birthplace of universal medical care. And so it was in Saskatchewan that a coalition of labor and farmers began the push for improving the access to health care, especially in rural areas. Okay, so not wanting to be left behind, this then prompted the federal government to do the same. And Stephen has talked about the fact that, you know, they had a 50-50 split in jointly funding this care between the federal government and provincial governments. Over time, Saskatchewan moved to a more comprehensive plan, and again, the federal government moved forward with a national plan, the Medical Care Act of 1966. I mean, we all know that this is the work of Tommy Douglas, who began at a grassroots level in Saskatchewan and then moved the fight to Ottawa to create the national plan. The Medical Care Act established a nationwide healthcare plan, and it really was focused on preventative and curative services delivered by family physicians and hospital services, right? Unfortunately, at the time, the focus was on acute care and was only part of the first phase of Tommy Douglas's vision for universal medical care. We've not moved on to the second part of the vision, the greater focus on illness prevention and health promotion. The second phase was also to include establishing and implementing policies around the social determinants of health, especially around poverty and inequality. You know, this is the work that is familiar to those of you that are advocates in unions. You can see that in the resolutions that are in your convention booklet. In terms of dental care, it's not clear why this dental services were excluded from the continuum of care when both preventative dental services and drug coverage were supposed to be part of phase 1 of Medicare. It's not clear to me why your teeth are considered anything different than any other body part, right? Today, it's recognized that the dentist can and should be a partner in your health care. It's clear that good dental care, the provision of preventative services like cleaning, polishing, and dental exams contribute to the general health of an individual. Many conditions arise elsewhere in the body, but they make themselves known by changes in your oral health. And the dentist can bring these observations to your attention. It certainly begs the question why the general dental exam and an annual cleaning and basic fillings are not part of the universal medical care plan that was established, and why it wasn't there from the outset. The history of vision care is a little bit different. This service was once covered fully in Alberta, but was delisted in 1995 for those aged 19 to 64. And you know, rather than a philosophical move or that was driven by health outcomes, considering, you know, maybe we need to look at who was the government of the day and our premier at that time. Certainly, Alberta Health recognizes that yearly vision exams are important for the very young, as well as for seniors. And about 5 years later, they expanded the coverage to include adults who have diagnoses with conditions where there might be an effect to their vision, things like diabetes or high blood pressure. Those individuals have the eye health part of an optometrist exam covered by Alberta Health. The actual assessment of the vision correction needs, however, remains outside of healthcare. For the rest of the general adult population, the individual or their benefit plan must bear the full costs of having their eyes examined. As with dental care, the question remains, why an annual or biannual exam for eye health and to assess the need for corrective lenses is not covered? Why are these exams and tests not seen as similar to other diagnostic tests that are performed on other parts of the body? How is it that checking for good vision for everyone is not seen the same as checking blood for cholesterol or sugar, or the heart for its proper functioning? It just seems an arbitrary removal from the system. The struggle to expand services is not limited to the public health stage. It's important that unions continue the fight to not only retain, but also to improve their members' benefit plans. Where union contracts begin to expand, that provides pressure on the private sector plans to do the same. Right? If the scope of our benefit plans is narrowed, it gives a false sense that these items are not important to our members. Delisting in the plans will result in delisting elsewhere and then no coverage. While this is an important factor to be mindful of, it does not reduce the need for expansion of our current healthcare systems to include a wider scope of services. I'd just like to take a moment to talk a little bit about what NASA has done in this respect. For almost a decade and a half, we have been working jointly with the employer at the University of Alberta to steward our benefit plan dollars, trying to maximize the value of the spend for our members. We've also engaged our members in campaigns to lobby government with other partners like Friends of Medicare, as well as we've initiated a campaign on reestablishing a dental fee guide for Alberta. NASA was pleased to share that campaign with others unions via our own connections and through the AFL. We are all aware that what goes into benefits is not available for wages. Our employer has certainly been clear about that. By being shrewd healthcare consumers, by understanding the trends and market drivers in healthcare, we've been able to move ahead of the crest and been diligent about limiting the liability and risk of increasing costs to the benefit plans. As a result, we remain one of the few, if not the only plan in Alberta that has 100% coverage and 100% employer-paid premiums. Certainly true amongst the public sector plans. All of us are taxpayers and can appreciate the pressures on the public purse at all levels of government. Many of you work in the public sector and have lived through the funding pressures on your employers. However, there have been countless studies to indicate that the delivery of healthcare via public system is the most efficient way to go. It provides the greatest reach and the best value for the dollars expended. Taking the profit out of these services would reduce the cost to our benefit plans or to those without benefits coverage to their pocketbooks. To expand healthcare coverage to include basic services in dental and vision care only makes sense and would ensure that the residents of Alberta truly have a comprehensive basic health services. Everyone can appreciate that the cost of cosmetic dentistry and that designer eyewear are outside the obligations of a healthcare system. That's not what's being contemplated here in the call for expansion. However, the provision of exams for eye and dental health, as well as the provision of basic services for cleaning and filling of teeth, appear to be logical inclusions in the public health system. I would ask that you support or continue to work on the initiatives of your own unions and those led by the AFL. Thank you.
Thank you.